Good afternoon, everyone. Thank you for those who have joined so far. We're going to give the rest of the people a few more minutes before we get started. Good afternoon and welcome to the 4th North Carolina HealthConnex Teletown Hall webinar. I'm Lee Jackson, Business and Provider Relations Manager for the North Carolina Health Information Exchange Authority, and with me here today I have several other members from the HIEA and SAS technical team. After listening to feedback from our providers across the state, we wanted to provide our participants with some guidance around the patient opt-out process, as well as some information on frequent issues that are addressed by the NC HealthConnex Help Desk. Just as a reminder, this training will be recorded and we'll have it posted to our website, www.nchealthconnex.gov, within 2 business weeks. Before we begin, I'd like to run through a few housekeeping items. Due to the limited amount of time allotted for this presentation, and because we have so many participants who've called in today, we'll be putting everyone on mute. If you have questions, please utilize the chat feature within the WebEx. Click on the chat icon shown in the red square here, and then type your question into the text box as shown in the red rectangle. When you submit your questions, please be sure to click on the drop-down menu for Send To and select Cameron Muir. We'll try to address questions at the end of the presentation as time allows, and if you have questions specifically related to your practice, we will contact you individually to answer those. Over the next hour, we'll be covering the topics that you see listed here. Introductions of staff members from both the NC HIEA and SAS technical teams, a quick run-through of our website highlighting key areas of information related to today's presentation, such as policies, training, and tools for your use. Then we'll discuss patient opt-outs and how you can educate your patients. Then I'll turn the presentation over to Holly Elliott from SAS to cover hot topics seen by the NC HealthConnex Help Desk. At the end of today's presentation, we'll have an opportunity for questions, feedback, and suggestions for future Teletown Hall topics. So from the HIEA team today, we have Christy Burris, Strategic Communications and Acting Director. And we've also got Cameron Muir, Provider Relations Specialist, and Kelly McDonald, also Provider Relations Specialist, who has recently joined our team in the last couple of weeks.
And from our SAS support team, we have Arn Koda, Principal Technical Support Analyst, Terrence Atkinson, Senior Technical Support Analyst, myself, Holly Elliott, Technical Support Analyst, Suman Kamath, Senior Technical Support Account Manager, and Kristen Summers, Senior Manager.
Good afternoon, everyone. This is Christy Burris. I wanted to give you a few updates regarding what's going on with NC HealthConnex and the HIEA before we move into the actual program regarding patient opt-outs. So I know many of you are curious about where we are with connections status to date. For those of you who have on-premise EHR technology, we are working with vendors to reach out to you and connect you directly to NC HealthConnex. But for those, and some of you are already in flight and some of you may be on hold. If you are on hold and want to know where the status of when you'll be reached and within the queue, please reach out to the Provider Relations team and they can give you an update on where we are there. For those of you who are utilizing cloud-based solutions with your EHR vendors, we have successfully completed the integration with Allscripts for cloud-based products, and Allscripts is working with us to give us lists of providers to onboard. So I would reach out to your Allscripts account representative to find out where you are in their queue, but that is moving forward. We are almost complete with our pilot build for Athena customers for the cloud-based product, and that should happen, I think, within this week is what I was told earlier today. And then you'll be working with Athena again if you're a cloud-based Athena customer to determine where you are in their onboarding queue. For all others, we're still in development or test, and so when we meet again next quarter, we'll give you an update where we are there for those cloud-based products. Next on our list is Provider Directory. Thank you for those of you who have participated in that in the past. We are sending that out this week for your feedback and changes to be made. We'll ask for your participant account administrators to submit any changes, additions, deletions back to us within a 2-business week, 10-day time period, and then we will update that and send out that final version for this year. Just to be clear, I know there's been a little bit of confusion for some of you who are coming on new to NC HealthConnex in the last year. This provider directory currently is specific to secure email addresses. It is not a comprehensive directory of every participant, but we do plan to be rolling that out in the coming year. But it is very focused on the secure, secure messaging that we provide. If you do not currently have a direct secure messaging address, either with your vendor or with NC HealthConnex, that is a service that we can provide to you, and you can reach out to the SAS Help Desk or to the Provider Relations team to inquire. So I think I've kind of covered Provider Directory and Direct Secure Messaging in one fell swoop, so that's great. Clinical notifications. We have several options for use of clinical notifications with NC HealthConnex. There is an option within the portal that you would go in and make the customization within your practice for your patients. The directions on how to do that are spelled out in the user guide, which is linked to our website. We are also building clinical notifications out of our analytics environment, and that is in pilot right now with one large health system as well as with an ACO, Federally Qualified Health Center. If you are interested in learning more about that pilot project, I would encourage you again to reach out to Provider Relations, and we can invite you to learn more about clinical notifications. And it is currently focused on admit and discharge of where your patients are touching the system. We also formed a disease registry work group in partnership with NCHICA, and the first registry that we are in development is a diabetes disease registry. And that group is meeting quarterly as well and has shown great progress in its first year. We've identified the folks who are moving forward with use cases and the proof of concept, and should be close to rolling that out in terms of on our website for more information on how to register to participate at the beginning of next year. Additional work groups that the NCHIE team has formed this year are behavioral health and a dental work group. And again, those meet quarterly. We hosted our first dental work group last week, and that will begin meeting quarterly to really pave the way in the path forward for dentists to connect to NC HealthConnex. So if you have dental within your practice, if you're a county health department or other, I think I would encourage you to participate in that work group as well.
One of the best resources that's going to be available to you as a participant is our website, www.nchealthconnex.gov. So from the home page, if you scroll down to the bottom, you'll see these 6 boxes that will link you to very valuable information. In the first box, you can see a list of those participants who are currently live in production, as well as those with signed participation agreements who are in the queue to connect. The top middle box links you to information on how to connect, and this includes information on what's required to connect, a link to our participation agreement, and a list of those EHR vendors with whom we've already established working relationships. Next, on the top right, you'll see a link to our frequently asked questions page, and this contains information about who we are, the type of data we collect, and answers to questions patients may have about NC HealthConnex. The bottom left box brings you to our news and updates page, where you can read our latest press releases and monthly updates. You can also sign up to receive email alerts from NC HealthConnex from this page. The next box links you to our advisory board page, and you'll find information here about who is on the board and when our next meeting will take place. And finally, you'll see a link to our guiding principles, where you can read about our mission, values, and goals. Also, on the home page, you'll see a For Providers tab at the top. This link will be especially helpful for you through the connection process, and in particular, I encourage you to view the Policies link, which covers in detail our privacy and security, user access, and behavioral health sensitive data policies, as well as the patient opt-out information we'll be discussing today. And under this same tab for providers is a link to our training and tools page. On this page, you'll find multiple training tools for your use, including past recordings of teletown halls. And this is where you'll find today's recording once we have it posted to the website. Additionally, you can find information about obtaining portal credentials, or if you need assistance with logging in, you'll find that information from this page as well. So now I want to read through the legislation surrounding patient opt-outs. The law defines an opt-out as an individual's affirmative decision communicated by the authority in writing to disallow his or her protected health information maintained by the authority from being disclosed by the authority to other covered entities or persons or entities through the HIE network. So to summarize, an opt-out is a patient's choice to keep their health information from being disclosed to another user of NC HealthConnex. The law also states that each individual has the right on a continuing basis to opt out or rescind a decision to opt out. The authority or its designee shall enforce an individual's decision to opt out or rescind an opt-out prospectively from the date the authority or its designee receives written notice of the individual's decision to opt out or rescind an opt-out in the manner prescribed by the authority. An individual's decision to opt out or rescind an opt-out does not affect any disclosures made by the authority or covered entities through the HIE network prior to receipt by the authority or its designee of the individual's written notice to opt out or rescind that opt-out. This means that any patient of a participant has the right to opt out and subsequently to rescind that opt-out should they choose, and that the authority ensures that the opt-out is enforced from the time the written request was submitted, but not before. The law continues to read, except as otherwise permitted in the statute, the protected health information of an individual who has exercised the right to opt out may not be made accessible or disclosed to covered entities or any other person or entity through the HIE network for any purpose. This means that when a patient chooses to opt out, their medical information will not be accessible or viewable by any healthcare provider system users with access to NC HealthConnex. Section 5.10 of the NC-HIEA Privacy and Security Policies comes from the law and reads as follows. Pursuant to the statute, the NC-HIEA shall engage in public awareness to educate North Carolina residents and providers about NC HealthConnex, including the right of individuals and their personal representatives to opt out. And pursuant to the law and the participation agreement, participants are required to educate their patients about NC HealthConnex, including the right of individuals and their personal representatives to opt out. At a minimum, participants' notice of privacy practices must include language surrounding the disclosure of PHI to NC HealthConnex and must make the notice available to all affected individuals. We as the authority have the legal responsibility to publicly educate North Carolina residents and providers about NC HealthConnex, specifically their right to opt out, and participants, meaning you all as providers, have the legal responsibility to educate your patients about their right to opt out. Now that we've covered the actual legislation, what will your patients need to know about opting out? First, patients have the right to opt out of having their medical data accessed through NC HealthConnex. Choosing to opt out does not affect the ability for a patient to access medical care. Opting out does not mean that data is not sent to NC HealthConnex. It simply means that it's hidden and inaccessible by any other healthcare provider system users. Those patients who have chosen to opt out may later choose to participate in NC HealthConnex by rescinding the initial opt-out request. All opt-out requests must be submitted by the patient or a legal representative to the North Carolina Health Information Exchange Authority, and these requests must be in writing. Patients may choose to opt out or rescind a previous opt-out by completing the patient opt-out form, which was included in your welcome packet, and it's also available on our website. Any completed forms have to be mailed to NCHIEA, and our team will process them within 2 business days after receipt. Once we've received an opt-out request and it's been processed, the patient will be notified in writing that the action is completed. There are 3 ways in which the authority can help you educate your patients. The first is the NC HealthConnex welcome packet. We also have our website, which we discussed earlier, and we have patient education brochures. Your welcome packet should have been sent to you via email along with your executed participation agreement. The packet includes pertinent information regarding the connection to the HIE and what it means for your staff and your patients. Also included in the packet are announcement tools such as sample emails and letters, talking points, both for the initial engagement with NC HealthConnex and your healthcare organization's go live with the exchange. Additionally, we've included patient education materials such as the 8x11 fact sheet and the patient opt-out form, which we saw on a previous slide. The welcome packet also includes an order form for patient education trifold brochures, and we'll discuss those in a couple of slides. If you didn't receive your welcome packet or you need us to send it to you again to get this information, please let us know using the chat feature or by emailing us at hiea@nc.gov, and we'll be happy to provide that to you. Again, our website is a great resource not only for you as a participant, but also for your patients. Under the For Patient tab, your patients can find information about what it means to have their healthcare organization connected to the exchange, and under your choices at the bottom, they can find information regarding the opt-out process, including the form to request their opt-out. The third way you can choose to educate your patients is by displaying patient education brochures in your organization. The NCHIEA will provide patient education trifold brochures at no cost to you. You simply need to request them. To order the brochures, fill out the form for your practice along with any participating entities, which would be your other locations, and indicate the number of packages and whether you would like English, Spanish, or both. We do not intervene in the manner in which these education materials are displayed. We leave that to your discretion, so we simply provide them to you. And this order form, again, is available on our website, and it's also included in the welcome packet. So if you've got questions regarding patient opt-outs, please use the chat feature in your WebEx, and we will be happy to address those at the end of the presentation. Unless they're specific to your practice, again, we'll reach out to you individually for those. And now I'm going to turn the presentation over to Holly Elliott with the Help Desk team.
Good morning. Questions that have come up, hot topics from the NC HealthConnex desk. Throughout the user audit process, we heard from many of you who have questions, and we would like to address those during the presentation. Some of those were, where can I find my NPI number, my national provider identifier? Another was, how do I add my digital signature to the user audit form? And what is Dsm Webmail? Where can I find my NPI number? You can access the NPI registry through the National Plan and Provider Enumeration System, shown in this link. From there, you can create or manage your account. You can also search the registry to find your organization provider number. There are two types of NPIs. Type 1 is for individual providers. Type 2 is for organizations. You would use the type you are affiliated with. If your practice has one physician, it would be type 1. For larger multi-physician practices or hospitals, you would use type 2. The number you add to the user audit form will depend on what type of facility you are representing, a multi-physician practice or a smaller single-physician practice. And below, there's a screenshot of what a search page looks like on the site, along with the different search options. Now I will show you the various ways you can add a signature to the user audit form. First, download and save the document. Then, within the PDF document, click on the signature line. Once you do that, you'll be prompted to indicate how you want to sign the document. Select a new digital ID I want to create now. Then click Next. Then you will be prompted to select how you would like to store your self-signed digital ID. I recommend you choose New PKCS number 12 digital ID file. Use the Windows Certificate Store if you want your signature to be available for tools outside of Adobe. Then select Next. Enter a password that you create, confirm your password, then click Finish. At that point, your newly created signature will appear. Enter your password and click Sign again. Before you're finished with the process, you will need to save your signature in your documents or on your desktop. Find or create a folder and save the document. Once you have saved your signature, it will appear on the PDF document. There are also three other ways you can add your signature to a document. You may type, draw, or insert an image of your signature. For any of the three, start by clicking on the Fill and Sign tab within the document. You may need to click on Tools to see this option. Then click Place Signature. When you click on Place Signature, you will be presented with three options in the drop-down menu. They are Type My Signature, Draw My Signature, Use an Image. To type your signature, simply enter your name in the Enter Your Name text box. Review your signature, then click Accept. You may also draw your signature using your mouse. Holding down the left key on your mouse, draw out your signature. This is a bit tricky to do, but again, you'll review your signature and click Accept if it looks okay to you. You can also use an image of your signature. To do this, sign a piece of paper, scan and email it to yourself, then save the document to your files. Select Use an Image from the drop-down menu, browse for the file, and then click Open to add the image to the signature box. And now my associate Arn Koda will talk about Dsm Webmail.
Good afternoon. What is Dsm Webmail? DSM stands for Direct Secure Messaging. It's a web-based tool that you may use as a secure way of sending and receiving emails between HISPs, Health Information Service Providers. Users access DSM Web via a secure login within their internet browser. You will be able to send and receive emails from any organization that is a trusted HISP. Again, that's Health Information Service Provider. Some points to consider about Dsm Webmail. There is no cost to you for this service. Also, you are not required to use this service. However, you must have a signed participation agreement on file to use the service. You do not need to wait to be fully connected to the NC HealthConnex portal to have an account. Certificates need to be renewed periodically, typically every 2 years, and the help desk will reach out to you when that time occurs. If you don't already have Dsm Webmail and you're interested in obtaining a domain and account, you can call or email the NC HealthConnex help desk team, and the phone number and email are provided here. What can you expect after you request your account? You'll be asked to complete the appropriate DSM account request form. Once you return the completed form, the account creation process through our vendor, Orion Health, will begin. Generally, within a week, you will receive an email from DigiCert requesting you return the DOI or Declaration of Identity to them. Your domain and account cannot be created until this form is uploaded to DigiCert. It is very important that you upload this document directly to the DigiCert site and not send it to the help desk or anyone else, as it will contain PII. You will be contacted via email when the domain and administrator accounts have been created. This introductory email will include your domain name and your certificate expiration date. Please refer to the NCHIE Training and Tools page for a previous town hall where we covered DSM use in detail. What is DOI? DOI stands for Declaration of Identity. DOI helps to ensure that only authorized organizations are using the Orion Health Communications Network or other trusted HISP. The DOI authorizes Orion Health to provide direct digital certificates on behalf of healthcare organizations or HCOs. DOI documents are required for DSM Web, and they need to be renewed on a regular basis. If nothing is changed, they can be renewed automatically by Orion with your permission. If the participant DSM point of contact has changed, a new DOI will be required to be filled out. Who is DigiCert? DigiCert is a trusted third-party certification authority approved by the government to issue Federal Bridge Certification Authority, FBCA, certificates. After the identification process is complete, DigiCert will issue a digital certificate to Orion attesting the DSM administrator's identity. And now I'm going to pass it back to Holly, who will talk to you about PAA best practices.
Keep your clinical portal accounts active. To do this, log in regularly. Accounts become disabled after 45 days of inactivity. This requires the help desk to enable your account. Also, passwords expire every 90 days and must be changed. You will not be prompted to change your password. We recommend you put a note on your calendar. Also, set up your security question. It will allow you to change your password without calling the help desk. We recommend that you request your users do the same as far as logging in at a minimum of every 5 days. You might send a calendar invitation to your staff to remind them to do this once a month. Also, we recommend users put a note on their calendars to remind themselves to reset their passwords prior to the 90-day expiration period. Use the same naming conventions we used in creating your user account. If your name is, or your username is abc.john.smith, the accounts you create for your staff should be in the same format. You can see the two examples that I've provided. In some cases, your user ID may include your full facility name if you have a short facility name. Also, include each user's email address and then select the facility name when creating new user accounts. It's best that you enter as much information as you can. You will not be able to bring up a view of all your users if you do not add the facility name, and you will not be able to add it later. Do this when you first set up the account. The example shown is a number. However, in most cases, it will be the full name of your facility. Also, please let us know if you need to change who the PAA on record is for your facility. You can also add a second or third PAA. You may have up to 3 for your facility. It's important that you're proactive in requesting a new or additional individual be added as the PAA on record. The PAA on record is the one who is responsible for signing the user audit form. Now we will take questions. Again, use your chat feature within the WebEx to ask your question. If we do not get to your question during this live presentation, we'll make a point of getting back to you. All questions are being documented so we can follow up with you.
So we're looking through our questions right now, and looks like there are some about welcome packets. Again, we will be sending those out to you who have requested them. And the welcome packet is sent when your participation agreement is signed and executed. But again, if anyone who doesn't have that or would like it again, we're happy to send those out. And also, this WebEx, just as a reminder, is going to be posted to our website in the next 10 business days. For those of you who would like to have the slides immediately, if you will send an email to hiea@nc.gov that you can see on the screen here, or use the chat feature and let us know, we're happy to send the slide deck out to you. We're just reading through a couple more questions now.
So we have a question about the documentation for consent for minors being addressed for public health. We are working with the EHR vendors with our county health department specifically to address those sensitive requests for minors at the EHR level. So you could, if you are a county health department and you're on the line, you would work with your EHR vendor. We're working with public health to work with the vendors.
So we'll give a couple more minutes for any other questions. So we have a question about who would be the appropriate contact person to have that discussion about minor opt-outs with the EHR vendor. That would be your participant account administrator on record, and that's included, you would have named that person in your participation agreement. So that the PAA would reach out to the EHR vendor account representative for more information on their ability to filter that. So, and a good contact person on our end for the EHR vendor would be Vanessa Green. And her email is her name, first name, Vanessa, V-A-N-E-S-S-A, .green with no E, @nc.gov. We also had a question about the time frame for providing patient education materials to your patients. That time frame is not mandated by the law, but we encourage you to start educating them or preparing to educate them as soon as you've signed the agreement.
We also have a question about, will the HIE information contain clients who have substance use abuse in their records? And yes, we will take on clients from the behavioral health community. With that said, currently our policy is if you have called yourself out as a Part 2 facility, you are relieved by law of sending that, connecting to NC HealthConnex and sending your patient data. If you are a facility that has a mix of treatment programs, and so you probably have some Part 2 facility treatment, but you also provide other behavioral health or mental health treatment, you are still required to send that data to us. We are not a QSO at this point and cannot accept that sensitive substance use data. We also are not accepting psychotherapy notes. And so, again, that's covered on the policies that Lee referred to earlier in the presentation on our website. We have behavioral health and sensitive data policies that you can read specifically on what we require from you and what we ask for you please not to send to us, as we're not qualified to receive it.
And any of you who need specific information or you'd like more information on where your EHR vendor is, if we didn't mention them, just send us an email at hiea@nc.gov, and we're happy to give you a status update. So part of the last minutes of this time, or if you think of them later, we also are welcoming any suggestions you have for future teletown hall sessions and topics. We really want to make sure that we're covering the information that you all need, so we're open to suggestions from you. Okay, so it looks like we don't have any other questions coming in. Thank you all very much for participating. Again, these slides are available to you upon request. Just send us an email at hiea@nc.gov, and within 2 business weeks, we'll have the recording of this presentation posted on our website. And you can see the contact information for the HIEA and the SAS HIE support desk on this page. If there are no other questions, we'll let you get back to your lunch hour. Thank you so much for participating.